I stared at the image on my phone, reading Dr. Maya Patel's text message for the 10th time as my world shifted beneath my feet. Sorry, Avery. Emergency meeting with potential investors. I'll miss your presentation. Something felt off. It wasn't the message itself, but the LinkedIn post that appeared moments later showing Connor at the biotech reception, his arm around a pharmaceutical rep who definitely wasn't me. My name is Avery Mitchell, and I'd built my medical device startup from the ground up while planning my wedding to a man who apparently couldn't even craft a decent excuse. The irony wasn't lost on me. I'd spent 3 years developing breakthrough technology in patient monitoring systems, while he spent his time monitoring other women's Instagram profiles. My hands trembled slightly as I navigated through the convention center's maze-like corridors. The security guard recognized me. I'd been rehearsing my presentation in the main hall since dawn. I used my keynote speaker badge, the one Connor had watched me receive with such proclaimed pride, and entered the reception area. "Honey, what a surprise!" I called out, my voice carrying across the champagne-clinking crowd. The sudden silence and scrambling movement by the investor panel's table told me everything I needed to know. Connor emerged from the group, his perfect pitch meeting smile faltering. "Avery, I thought you were preparing for your presentation? Funny, I thought you were in an emergency investor meeting." I held up my phone, showing him the LinkedIn post. "Unless biopharma reps are your new target market." The blonde in the designer suit appeared beside him, champagne glass freezing halfway to her lips. "You said you were separated." "He isn't," I said, sliding my engagement ring off my finger, "but I'm about to fix that for him." The platinum band bounced off his perfectly pressed shirt and clattered across the marble floor, the sound echoing in the now silent room. "Baby, please." Connor stepped toward me, lowering his voice. "This isn't what you think. Let me explain. There are bigger things at play here. Save the pitch for someone who still believes in your projections." I turned to leave, but he grabbed my arm. "You're being dramatic. Think about what this means for the merger talks." I yanked free, suddenly aware of the industry eyes watching us. "Don't touch me. We're done." The elevator ride down was a blur of notification sounds, calls from Connor, messages from my mother, even texts from my brother Blake. I ignored them all until I reached my car, where apparently the entire Mitchell family had staged an intervention. "Avery, what have you done?" My mother, Victoria, rushed forward in her perfectly tailored suit. Connor called us in tears. "Do you have any idea what this could do to the merger negotiations?" I tried to push past her, but my father blocked the way. "Princess," Harrison Mitchell's CEO voice was in full effect, "you're being hasty. Every business deal has its complications. Connor is a valuable partner." "A valuable partner?" I laughed bitterly. "I caught him with a competitor's rep, Dad, at our industry's biggest event, right before my keynote presentation. Men in this position have certain networking requirements." My sister-in-law, Rachel, chimed in, adjusting her Hermes scarf. "You can't throw away a strategic alliance over one indiscretion." The confrontation. I looked at them all, my mother wringing her manicured hands, my father's stern CEO glare, Blake's calculating stare, Rachel's smugly practical expression. These people were supposed to be my support system, my family. "He's been feeding our competitors information for months," I said, my voice shaking with fury. "Probably longer. And you're all standing here defending him?" "He's integral to this family's future," Blake said, stepping forward in his expensive suit. "Has been since he structured the series of funding for Mitchell Medical. His firm's merger offer could save Dad's legacy." There it was, the real reason they were all here. It wasn't about my happiness or my company's breakthrough technology. It was about saving the family's struggling medical device empire. My innovative startup had been their ticket to modernization, and Connor had wormed his way into both my heart and my father's boardroom. I can't believe this. I shook my head, clutching my presentation notes. My own family cares more about their market position than the fact that my finance was selling our trade secrets. Now you're just being childish, my mother snapped. This is exactly why Connor probably felt driven to. Don't you dare finish that sentence. My voice cut through the parking garage like a scalpel. Don't you dare blame me for his corporate espionage. Avery. My father's voice took on that patronizing tone he used in board meetings. Sleep on it. Tomorrow you'll see the bigger strategic picture. Oh, I see the picture perfectly clearly right now. I walked past them to my Tesla. I see exactly who you all are and what my innovations mean to you. Don't be dramatic, Rachel called after me. This is why you can't maintain strategic partnerships. You're too emotional, too focused on your little startup instead of. I slammed the car door, cutting off her words. Through the tinted windows, I watched them huddle together, probably plotting their next attempt to salvage the merger. But as I sat there, something crystallized inside me. The hurt was still there, but now it was hardening into resolution. They thought my company was just a little startup. They thought I needed Connor, needed their corporate backing. Fine, let them think that. At the office, I drove straight to my office and opened my laptop. It was time to make some calls, starting with Dr. Morgan Hayes, the leading venture capitalist in medical technology. If they wanted Connor's outdated business model so badly, they could have it, but they were about to learn exactly what cutting-edge innovation looked like. The Venture Capital Meeting. You're seeking Series B funding now? Dr. Morgan Hayes nearly choked on her espresso across the conference room table. Avery, your patient monitoring system is projected to revolutionize post-operative care. The timing with the merger. I need a clean start, I said, watching the financial projections scroll across my screen. And I need it to happen quietly. How fast can you make this work? With these clinical trial results. A week, maybe two. But are you certain about this trajectory? A text from Connor lit up my phone. Your mother's worried sick. The board is meeting tomorrow. Stop being stubborn and come to the table. Completely certain, I replied, closing the message without responding. And Morgan, I want you to prioritize independent investors. No family business entanglements. The next 2 weeks passed in a blur of due diligence, patent applications, and ignored calls. I transferred my research data to secure servers while fielding increasingly aggressive attempts from my family to fix things. They didn't know I'd already signed the new funding documents or leased lab space in Boston's biotech corridor. You can't avoid the board forever, Blake cornered me outside my lab one morning. Mom's barely sleeping. Dad's blood pressure is through the roof. Funny how nobody seemed concerned about my well-being when Connor was selling our IP to competitors. He made a strategic misstep. And what about Dad's company? The whole restructuring plan hinged on integrating your monitoring system. I laughed bitterly. So that's what my research was worth to you all. A corporate bailout. Don't be naive. Everything's interconnected. Your little startup. My little startup that has 3 pending patents. That's attracted interest from every major hospital group. That kept Mitchell Medical relevant during the pandemic? I shook my head. You know what? You're right. Everything is connected, and it's time to disconnect. The move. The lab relocation team arrived the next day. I'd timed it perfectly. Everyone would be at the quarterly board meeting. As the last server was being packed, Rachel's Mercedes screeched into the parking lot. What are you doing? She jumped out, phone already recording. Avery, stop this corporate suicide right now. Or what? You'll post it on LinkedIn? Show everyone how unstable the innovative Mitchell is. I signed the final transfer papers. Go ahead. Our clinical trial results will get more engagement. The board will be devastated. Is that what you want? What I wanted was support when my clients betrayed us. What I wanted was a family who valued innovation more than their market position. I handed her an envelope. Give this to them after the meeting. The breaking point. What is it? My resignation from the Mitchell Medical Board. And don't bother trying to trace our new research facility. By the time you read it, we'll be fully operational elsewhere. The drive to Boston was 8 hours of liberation. With each mile marker, the weight of family expectations lifted. My phone buzzed constantly until I finally pulled into a biotech park to read the messages. Mom, how could you transfer your research without board approval? What about the family legacy? Dad, this is completely irresponsible. Your grandfather built this company. Call me immediately. Blake, you're destroying decades of Mitchell Medical's reputation. Connor, you're making a huge mistake. The merger terms are exceptional. I switched off my phone and walked to the lab building's cafe. The barista smiled as she handed me my coffee. Rough day? Actually, I smiled back. It's the first day of real innovation. New beginnings. My new lab space was smaller than my old facility, but the view of Boston's biotech corridor made up for it. I unpacked only the essential equipment and left the rest in storage. The Series B funding had netted enough to start fresh, to invest in other researchers who, like me, had dreams bigger than corporate constraints. That night, I sat on my empty balcony with a glass of wine and finally turned my phone back on. Hundreds of messages, dozens of missed calls. One caught my eye, from Rachel. You think you're so clever, running away? Well, guess what? Your precious family needs you, and you abandoned them. Connor is helping restructure Mitchell Medical, something you clearly couldn't be bothered to do. You'll regret this when you're alone with nothing but your patents to keep you warm. I took a screenshot of our latest clinical trial results, showing unprecedented success rates, and sent it as a reply. Then, I blocked her number, followed by everyone else's, one by one. I erased the ties that had bound me to a life of corporate compromise. Tomorrow, I had meetings with 3 brilliant medical researchers who needed funding and mentorship. They had innovation in their minds and passion in their hearts, just like I did before my family tried to stifle my ambitions. Let Rachel worry about maintaining Mitchell Medical's market share. I had lives to save. At Morgan's office. You're telling me you walked away from a major medical device merger and moved cities just to spite your family? Dr. Morgan Hayes leaned back in her chair, studying me over her tablet, displaying our latest trial data. We sat in her sleek office overlooking Boston's biotech hub, the morning sun glinting off neighboring research facilities. Not to spite them, I corrected, to free our innovation. There's a difference. She tapped her fingers on her desk. And now you want to fund other medical researchers with minimal corporate experience? I built my monitoring system from concept to clinical trials. I know what innovation takes. Development and venture capital, different beasts. Morgan stood and walked to her whiteboard. But I like your scientific integrity. Let me show you something. For the next hour, she outlined investment strategies, risk assessment, and the importance of clinical validation. I took notes frantically, barely keeping up with her expertise in both medicine and finance. Why are you helping me? I asked when she finally paused. We just met through a medical conference connection. Because 6 years ago, I was you, minus the dramatic escape. She smiled. Now want to see some real potential? I'm meeting a researcher in an hour. Come with me. The researcher turned out to be Dr. Maya Patel, a brilliant neurosurgeon with a revolutionary neural interface platform. Her presentation was flawless, but it was the passion for patient care in her eyes that caught my attention. The big medical corporations don't understand, Maya explained, pulling up her prototype data. They want me to water down the technology, make it more marketable, but that defeats the whole purpose of improving patient outcomes. Show me the clinical results, I said, recognizing the frustration in her voice. As she walked us through her trial data, my phone buzzed, a blocked number, but the voicemail notification made my stomach clench. Avery, it's Dad. Things aren't good at Mitchell Medical. We need to talk, please. The investment decision. I deleted the message without listening further. Maya was still presenting, but Morgan was watching me closely. Everything okay? She asked after Maya left. Family business stuff. It's nothing. Doesn't sound like nothing. She perched on her desk. Look, I'm not one for heart-to-hearts, but if you're going to succeed in biotech investment, you need to be focused, clear-headed. I am focused. Maya's neural interface project. That's exactly the kind of innovation I want to support. Good instincts. She's got potential, but… Morgan paused. You need to deal with whatever's brewing at Mitchell Medical. Trust me, it'll follow you otherwise. Later that evening, I sat in my new apartment, staring at my phone. 3 more missed calls from my father, 2 from Blake. Finally, I clicked on the most recent voicemail. Sis, you need to call Dad. The merger fell through. Connor, he pulled his firm's support after you left. Mitchell Medical is in trouble, like serious FDA compliance trouble. Just call us, okay? I poured myself a glass of wine and walked to my window. Below, Boston's biotech corridor glowed with laboratory lights, a constellation of possibilities. My phone buzzed again. This time it was Morgan. Got the final regulatory approval for your Series B funding. Also, Maya's asking for another meeting. You in? I typed back quickly. Absolutely. And Morgan, thank you. Don't thank me yet. Wait until you lose your first million on a failed clinical trial. I laughed, but my amusement was cut short by another call, this time from Rachel. What? I answered sharply. Oh, so you are alive, she sneered. Must be nice playing venture capitalist in Boston while Mitchell Medical falls apart. The confrontation call. What do you want, Rachel? Your father's company is failing its FDA audits. Blake's position is on the line, but you don't care, do you? Too busy playing biotech investor with your breakthrough technology. Breakthrough technology. You mean the innovation you all dismissed as a little side project. You know what? You deserve to be alone when your precious startup crashes and burns. I hung up, blocking yet another number. My hands were shaking as I opened my laptop and pulled up Mitchell Medical's regulatory filings. They were public record, after all. What I saw made me wince. Rachel wasn't lying. The compliance reports were damning. My phone lit up with a text from Maya. Hey, I reworked some trial protocols based on your questions. Coffee tomorrow? I looked at the message, then back at my father's company's compliance reports. The contrast was stark. One represented my past with all its compromises and constraints. The other was my future, full of potential and purpose. I typed back to Maya. Coffee sounds perfect. I have some ideas about scaling the trials. Let them think I was running away. The truth was, for the first time in my life, I was running towards something that could actually change patients' lives. The investment meeting. I'm investing $2 million in your neural interface trials, I told Maya across the coffee shop table. Her eyes widened, coffee cup frozen halfway to her mouth. Are you serious? She set the cup down with shaking hands. But you said you needed more validation data too. I've seen enough. Your prototype works, your preliminary trials are solid, and frankly, I'm tired of watching brilliant innovations get overlooked by traditional medical device companies. As we discussed protocols, My phone lit up with an incoming call from Blake. I declined it, but he immediately called back. "You should get that," Maya said gently. "Family stuff has a way of festering if you ignore it." The family crisis. I stepped outside, bracing myself. "What is it, Blake?" "Dad's in the hospital." His voice cracked. "Stress-induced cardiac event. Minor, but he's asking for you." The world tilted slightly. "Is he okay?" "For now, but Mitchell Medical's failing FDA compliance checks. We're laying off research staff next week." Remember Dr. Thompson from R&D? 20 years with the company. Groundbreaking work in cardiac monitoring. He'll be first to go. The guilt punch landed exactly as he intended. "That's not my fault, Blake." "No." "Connor's firm pulled their regulatory support the day after you left. Said they couldn't trust a family that produced such unreliable innovation. Now the FD is questioning our entire quality control system. And, stop." I pressed my fingers to my temple. "Just stop. You can't blame me for Connor's decisions or Mitchell Medical's compliance issues." "Can't I?" "You knew what your little dramatic exit would cost us, but you only cared about your own research." I watched Maya through the window, reviewing the trial protocols with such dedication. "I have to go." "Of course you do. Run away. It's what you're good at." Back in the coffee shop. Back inside, Maya looked up with concern. "Everything okay?" "My father's in the hospital." I sat down heavily. "Minor cardiac event." "Oh God, I'm so sorry. We can do this another time." "No." I pulled out my pen. "Let's finish this now. I believe in your innovation and what it can do for patients. That's not changing because of family drama." We signed the investment agreement, making it official. As Maya hugged me goodbye, my phone buzzed with a text from my mother. "Your father asked about you today in the hospital. Remember when you were little and had your science fair project? He drove you to 3 different stores to find the right circuit board. Now he needs you. And where are you?" The pressure builds. I closed the message, hands trembling. Another text came through, this time from Rachel. "Hope you're proud of yourself. Mitchell Medical is laying off research staff next week. Brilliant scientists with families, groundbreaking projects, all because you couldn't handle one little corporate negotiation like an adult." I was about to block her when Morgan called. "Hey, heard you closed the deal with Maya. Want to celebrate?" "I can't, family emergency." Her voice softened. The past catching up. My father's in the hospital, cardiac event, and apparently I'm responsible for destroying Mitchell Medical's research division and ruining 30 scientists' careers. Interesting cause and effect there. Morgan paused. "Want some advice?" "Please." "Go see him." "What?" "Go see your father." "Not for him, for you. Face them all, say what you need to say, then leave. Otherwise, they'll keep living in your head, rent-free." I looked at my calendar. Maya's investment was secured, my other trials could wait. "You're right." I took a deep breath. "I'll book a flight." "Good, and Avery, remember, you're not that intimidated research assistant anymore. You're a successful biotech innovator now. Act like it." I booked a flight for the next morning, then called my brother. "I'm coming tomorrow," I said when he answered. "But let me be clear. I'm coming to see Dad, not to save Mitchell Medical." "Of course not," he sneered. "Why would you help the company that funded your early research?" "The company that funded my research." "You mean the company that tried to bury my innovations under corporate bureaucracy?" "That company?" He made one business decision, and I made one choice to value patient outcomes over profit margins. Deal with it. I hung up and opened my laptop, pulling up Mitchell Medical's compliance reports again. The violations were even worse than before. Part of me wanted to swoop in, fix everything, be the good daughter they wanted. But as I looked at the investment agreement with Maya, I remembered why I left. They hadn't just sided with Connor, they tried to compromise my research integrity. And if I saved them now, nothing would change. The decision. My phone buzzed one last time. A message from Maya. Just told my research team about the investment. They're crying happy tears. Your funding means we can complete the neural interface trials without compromising our safety protocols. You've changed lives today, Avery. Thank you for believing in us. I smiled, screenshot the message, and booked my hotel. Tomorrow, I'd face my past, but tonight, I'd celebrate funding research that put patients first, not from obligation, but from scientific integrity. 3 months later, 3 months after my brief, tense hospital visit with my father, I sat in Morgan's office reviewing Maya's latest trial results. The numbers were groundbreaking. She's exceeded safety protocols by 40%, Morgan whistled. Your first investment's looking like a medical breakthrough. The neural interface market was ready for innovation, I said, scrolling through the data. And Maya is brilliant. Yes, but let's talk about your other wins. Morgan pulled up a spreadsheet. 3 more successful investments in groundbreaking medical research. You've got good scientific instincts, kid. My phone buzzed. Another email from Blake. I'd been getting them weekly since Dad's hospital stay. Always the same guilt-ridden message in different words. I deleted it without reading. Speaking of instincts, Morgan leaned forward. There's a medical innovation conference downtown tonight. Maya's presenting the trial results. You should come. The conference hall was packed with biotech leaders. Maya owned the stage, confidently presenting her neural interface breakthrough. I stood at the back, pride swelling in my chest, when a familiar voice froze me in place. Avery? I turned slowly. Connor stood there in an expensive suit, looking exactly as he had the day I caught him sharing our trade secrets. What are you doing in Boston? The confrontation. Due diligence work. He glanced around before stepping closer. I've been trying to reach you through the family. Classy. They're worried about you. We all are. He lowered his voice. Mitchell Medical is barely passing FDA inspections. Blake's looking for work. Even your mother had to cut the research budget. He paused meaningfully. And you could help. You have the resources now. I heard about your successful investments. Stop. I held up my hand. Is that why you're here? To convince me to bail them out? I'm here for a client, but seeing you. He reached for my arm. I miss you, Avery. We all do. What you're doing with these startups is admirable, but Maya's voice cut through the tension. She rushed over, trial results in hand. The NIH reviewers want to meet. Oh, sorry, am I interrupting? Not at all. I stepped away from Connor. Maya, this is my ex-fiance. He was just leaving. Connor straightened his tie. I'd love to hear about your neural interface. Maybe there's potential for collaboration with my firm? Your firm? I laughed coldly. The same firm that pulled regulatory support from Mitchell Medical the minute things got tough. That firm? Maya's eyes widened with recognition. Oh, you're that Connor. Sorry, but we don't compromise on patient safety for quick profits. The NIH team is waiting. As we walked away, I heard Connor call out, Your family needs you, Avery. How long are you going to punish them? I turned back. I'm not punishing anyone. I'm investing in researchers who believe in patient outcomes as much as I believe in them, something my family never did. The celebration. Later that night, over celebratory drinks with Maya and her research team, my phone lit up with a text from Rachel. Saw Connor today. He told us about your little success story. Must be nice playing medical investor while Mitchell Medical struggles through FDA audits. Mom's selling research equipment now. I showed the text to Maya, who snorted. Wow, they really know how to manipulate data, don't they? They think profit margins equal innovation, I sighed. That's why they can't understand why I won't help. But you're helping. Maya gestured to her team, celebrating their successful trial presentation. Just not them. My phone buzzed again. Morgan this time. Heard Connor showed up. You okay? I looked around the bar at these brilliant researchers I'd invested in. At Maya, whose neural interface was changing patients' lives. At the future I was building, free from corporate compromise and regulatory shortcuts. Never better, I replied. Good, because wait until you see tomorrow's medical journal. Maya's trials just got fast-tracked by the FDA. You're not just surviving anymore, kid. You're revolutionizing patient care. I raised my glass to Maya, to believing in scientific integrity. To scientific integrity, she echoed, then added with a grin, and to proving that innovation doesn't need corporate shortcuts. As if on cue, another text came through from my mother. Connor says you're doing well. Why won't you help your family's company? What did we do to deserve this? I blocked her number, then raised my glass again. And to choosing our own research family. The scientists around me cheered, none of them knowing the full weight of that toast. But as I watched them celebrate their breakthrough, success I'd helped make possible, I realized something profound. My family had always seen my independence as betrayal. They'd never understand that it was actually liberation, not just for me, but for every patient whose life would be improved by the innovations we were developing. The final confrontation. He's waiting in your office, my assistant warned as I stepped off the elevator. I told him our medical trial review meetings were booked solid, but he insisted on waiting. I didn't need to ask who. Through the glass walls, I could see Connor sitting in one of my visitor chairs, scrolling through what looked like FDA reports. 2 weeks after our conference encounter, here he was, uninvited and unwelcome. How long has he been here? 3 hours. Should I call security? I straightened my lab coat. No, I'll handle this. Connor stood as I entered, his familiar cologne mixing unpleasantly with the sterile lab air. Finally, your assistant is quite protective, he said. She's good at protecting our research integrity. I sat behind my desk, not offering him a seat. Why are you here? You're all over the medical journals. He held up his tablet, showing an article about Maya's neural interface trials. Rising star in biotech investment, champion of ethical research. Quite the reputation you're building. Again, why are you here? He sat down, uninvited. Mitchell Medical filed for Chapter 11 yesterday. I know you saw the FDA reports. Blake lost his research position, Rachel, and he moved in with your parents. Your mother's devastating the research division. He leaned forward. One investment from you could save decades of medical research. Like you saved them by pulling regulatory support. That was business. This is family. Funny how those lines blur when it's convenient for you. I pulled up my calendar. I have a trial review in 10 minutes. The breaking point. For God's sake, Avery, he slammed his hand on my desk. Stop being so cold. These are people who dedicated their lives to medical research. Research. I laughed. They dedicated themselves to quarterly profits. There's a difference. We all made mistakes, me most of all. His voice softened. I've changed. Seeing you at the conference, hearing about your trial successes, I realized what I threw away. Let me guess, your regulatory consulting business isn't doing so well? He flinched. That's unfair. Is it? Because it seems like you only show up when you need FDA clearance. I stood up. The answer is no. I won't compromise Mitchell Medical's compliance requirements. I won't bail out Blake's failed research. And I definitely won't give you a second chance. Your mother was right, he spat, standing too. You've turned cold, clinical. No. I've turned ethical. There's a difference. My office door opened, and Maya walked in, stopping short at the scene. Oh, sorry, I'm early for our trial review. Perfect timing, I said. Connor was just leaving. This isn't over, he warned, moving toward the door. Actually, it is. I pressed the intercom. Security, please escort Mr. Parker out and update his status to restricted access. After he left, Maya whistled. Wow. You okay? Better than okay. I sat back down. Show me the new trial protocols. My phone buzzed. Blake. Happy now. Dad's company is officially bankrupt. 30 years of medical research gone. Hope your ethical stance was worth it. Then Rachel. Your mother can't stop crying. Congratulations, you've destroyed your family's medical legacy. Finally, my father. I never thought my own daughter would watch her family's research crumble when she could help. I don't recognize you anymore. The reflection. Maya watched me read the messages. They really don't understand medical ethics, do they? No, they don't. I put my phone away. They think this is about revenge. Isn't it? A little bit? I thought about it. Maybe at first, but now. Now it's about developing technology that actually helps patients. Speaking of which, show me those safety protocols again. We dove into work, but later that night, alone in my apartment, I pulled up an old photo on my phone. My family at last year's medical conference. All smiles and white coats, funded by my little side project. Connor, front and center, his arm around me, probably texting competitors under the table. My phone rang. Morgan, heard you had an interesting visitor today. News travels fast in biotech. Lightning speed. You okay? I looked at the photo again, then deleted it. You know what? I really am. Because I just got a tip about a brilliant researcher with a groundbreaking cancer detection system. Interested? I opened my laptop. Tell me more. Dinner. That new place near the research park? Perfect. I glanced at my phone one last time. 3 more messages from my family, all unread. Then I turned it off. Let them think I was being cold. Let them blame me for their compliance failures. I had meetings tomorrow with researchers who were building the future of medical care, not compromising patient safety for profit margins. Hey Morgan, I said before hanging up. Thank you for everything. Don't go soft on me now, she laughed. Save that energy for tomorrow's trial reviews. I looked out at the Boston skyline, laboratory lights twinkling with possibility. Somewhere out there, another researcher was dreaming big, fighting against people telling them to cut corners, compromise protocols, stay in their lane. I was done staying in my lane, and I was just getting started.